Rates of COVID-19 are growing rapidly in the United States and disproportionately affect individuals of low socioeconomic status. In cities, low-income communities have higher rates of COVID-19 than neighborhoods of higher income and educational attainment. This may be attributed to limitations on timely access to care for low-income individuals. Other factors that contribute to this disparity include congregate living settings, lack of regular access to hygiene supplies, and higher rates of chronic illness compared to the general population. The Sojourner Health Clinic is a free student-run clinic that provides primary health care predominantly to those who are homeless in downtown Kansas City. As COVID-19 may have a disproportionate effect on the underserved population of Kansas City, this study will analyze how underserved patients of this clinic understand and comply with CDC guidelines in comparison to volunteers attending the clinic. This study looked at two populations: Sojourner volunteers and patients present at the clinic during the designated study period. Subjects were selected at random and were given a standardized quiz consisting of 7 true or false statements to assess the participants' knowledge of guidelines set by the CDC. A t-test analysis was completed to spot differences between scores from the two study populations. Results indicated that Sojourner volunteers scored higher than patients. Patient scores had an average of 5.9, while volunteer scores had an average of 6.7. This offers a statistically significant difference that was not unexpected, as healthcare workers and students are well informed on disease transmission and prevention due to the integration of these topics in their training, while free health clinic patients are more likely to have a lower health literacy. These findings indicate that our patients may benefit from education on COVID guidelines, such as pamphlets given at the start of the clinic, or the addition of patient education sessions given by volunteers at the end of their encounter. One limitation is the exclusion of patients who did not pass initial screening for COVID, as they cannot be seen in the clinic. This may alter the results of the average patient score. Additionally, while the results of the study were statistically significant, the difference in score between the groups by less than 1 point may not offer as much clinical significance. Further studies with a larger sample size may be better to highlight the disparities in disease prevention and transmission knowledge between volunteers and patients.